dog surgery.
Hi, my name is Dr. Noelle Lucas, and I'm the owner and practicing veterinarian at Blue Oasis Pet Hospital. And I would like to talk about your dog's surgery and what that might be for you to prepare your pet for surgery. And I've got an assistant with me who's going to ask me a few questions about dog surgery.
Dr. Lucas, what do I need to know before my dog has any surgeries?
Well, first of all, dog surgery is kind of scary, right? It's surgery, and we all kind of get a little nervous about surgery. So really it's asking your veterinarian and their nurses just really any questions that you might have regarding that pet surgery, because surgery is such a general sort of concept. We can do skin surgery, abdominal surgery, spays, neuters, toe amputation I did the other day, so stones coming out of the urinary bladder, so lots of different surgeries that we do. So really, for you to be comfortable, it's about sitting down and actually having a conversation about what surgery is indicated and just all the questions and concerns you might have about that pet surgery.
Will my dog need lab work done before surgeries?
Yes, ideally, any dog going under general anesthesia should have just a basic CBC and a chemistry that allows us to see a little bit more internally and make sure that their red blood cells are okay, their platelets, their core organ function looks good, because we're going to rely on those red blood cell, white blood cell, platelets, and organs to function really well while we've got them under anesthesia.
Does my dog need to see a specialist for their surgery?
That depends. Sometimes a specialist is indicated, especially if the general doctor that you're working with, or like here, we don't do any real big orthopedic procedures. So like TPLOs would be a knee surgery. We don't do that. So we are going to probably refer you out to a specialist for that particular surgery. But there's a lot of talent in small animal veterinary hospitals. So oftentimes there are a lot of procedures that can be done in your general practitioner's office. Including here, we can get a lot of soft tissue surgeries done here.
What will my veterinarians be looking for in any kind of pre-surgery lab work?
So pre-surgical lab work, we're just making sure that organ function looks good and we've got good platelets, good red blood cell count. We're just making sure that you've got a healthy pet going under general anesthesia. And then if we do have any abnormalities, what are they? Are they clinically significant? And also, do we need to follow them up at a later visit?
And who monitors my dog while they're under anesthesia?
So because we're an AAHA accredited hospital, we do have licensed pet nurses or trained pet nurses. So they might not be licensed, but they're trained in general anesthesia monitoring. We also have the practicing clinician is also going to be helping monitor your pet. So that's the staff or the people, the team that are going to be watching over your dog while they're under anesthesia. But then we also rely on electronic monitoring. So we monitor ECG, pulse ox, temperature, pulse ox, temperature, ECG, blood pressure are all of the sort of things that we're monitoring while we've got your dog under anesthesia.
And how long will it take for my dog to usually recover after surgery?
So most recovery for surgical patients is typically about a week. That's the time for the skin that we've incised for the surgical procedure to really make a really strong bond, and then stitches can come out, or if we use skin glue, that glue is really starting to resorb. So we usually say about a week for your dog to recover from surgery is a good sort of ballpark. Of course, that can change depending if your dog is a little bit older or what the procedure is that they're having.
And how can I help my dog recover at home after surgery, or is that even possible?
Yeah, so helping your dog recover after general anesthesia and surgery is incredibly important at home. You're the pet parent, so you're the one to provide most of the comfort that they're going to need when they go home, just like when we have surgery, we want comfort from our family members. So having a sort of a nice place for them to go to recover. So your dog, just maybe having a pet bed, maybe being more on the floor with them, because we don't usually want our surgical patients to do a lot of jumping up on beds or on furniture. So making a pallet or a bed for them kind of in a general area or even in a corner of your bedroom, having food and water maybe close by so they don't have to walk very far, maybe making some accommodations on where they're going to go out for eliminations to be a little closer to where the recovery site is. Just trying to think of what they might need when you are bringing them to surgery, kind of prepare for going home, where they're going to be in that recovery process. So again, your veterinary professionals are going to be able to help walk you through your dog's surgery and what that might be and how they're going to recover at home. So we invite you to partner with your veterinarian and their team and ask all those questions that you have on your mind. And if you're in the Mount Juliet area or the Nashville area, we'd love to see you here at Blue Oasis Pet Hospital. Thank you so much.